Welcome, welcome to the Vital Village Networks of Opportunity for Child Wellbeing 2023 webinar series, Collaborative Action and Coalition Building, Transformative Practices for Healing, Joy, and Equity. Through this three-part series, we'll hear from leaders across the country who are using collective leadership approaches to design, build, and foster communities centered on the healing and joy of children and families. We're continuing our 2023 series today with three fantastic leaders who are deeply rooted in birth equity. They're all working to create a reality where Black and Brown people can bring babies into the world with dignity and joy. And so as we begin our time together, I'd like to acknowledge that we are continuing to strengthen our language justice practices. And this webinar series will be available in Spanish with interpretation services provided through our partners at the Community Language Cooperative based in Colorado. So at this time, I'd like to welcome Valentina to provide us with a brief orientation.
Thank you so much, Ronda. Hi, everyone. Good afternoon. My name is Valentina, and I'm here on behalf of Community Language Cooperative, and I'm here to provide and guarantee your commitment to language justice. Language justice is a type of simultaneous interpretation that seeks to create spaces in which no one language is dominant, spaces in which everyone can participate with the language of their heart. So to achieve this objective, we will be using Zoom's interpretation feature. And what you will see in a couple of minutes is a new little button that looks like a globe, like the one featured on the screen right now, will come up on the bottom bar of your screen. When you see this button, go ahead and click on it and select either English or Spanish as both the language that you will be listening into and speaking in.
Thank you so much. Thank you so much, Valentina. I believe we have that button up for us. So I just want to invite you all at this time to select the language that best suits your needs, again, by clicking the globe icon located on the bottom of your screen. So today's webinar will be recorded and posted on the Now Innovation Forum within the next few days. We encourage you to engage with us by sharing what resonates with you in the chat box and submitting questions through the Q&A. Our guests will have the opportunity to respond to questions a little bit later in the hour. So while we're only together for 1 hour, it will be packed with stories from the field and lessons for us to take back to our own practices. So I'll begin with a brief overview of Vital Village Networks and the networks of opportunity for child well-being, followed by remarks from our featured speakers, and then later you'll be able to pose questions before we wrap up with a few announcements of upcoming opportunities. And so whether you are joining us for the first time or have been with us for a while, I'd really like to offer you just a brief overview of Vital Village Networks. We are a collective of change makers committed to pioneering sustainable approaches to transforming child, family, and community well-being. We are rooted in Boston with a broad web of peers and partners across the country, all connected through our networks of opportunity for child well-being, better known as NOW. We are bonded through our guiding principles of creating shared spaces for belonging, learning, engaging, and transforming our communities together. If you want to hear more about our work and share stories from your own experience, we invite you to visit the Now Innovation Forum, where you'll find access to a variety of tools, resources, and stories of leaders working collaboratively to shift what it means for our children, our families, and our communities to thrive. Also want to share a little bit more about Boston Glowing, a birth equity coalition that's in the works, focused here in the Metro Boston area. You can learn more. We'll drop a link in the chat box, but you can learn more about our work, stay connected to us, stay connected to the work that we're doing through our Boston Glowing Constant Contact. So please stay connected with us. And so now that you've been oriented to Vital Village, and now I'd like to transition to hearing from our speakers. We'll hear today from Omari Maynard, Andre Nelson, and Tiffany Vassell. Their bios and their links to resources will be in the chat, I promise. So I encourage you to explore them after our time together. And before I turn things over to our speakers, I'd really like to invite you not only to listen, but to also consider what you're hearing and what actions you might take to advance your own work, the work that you're leading in your communities and in your regions. So following this session, you'll receive a reflective action guide for your own personal use that can help you unpack what you've heard, think about how it might apply to your own practices. And it's available in both Spanish and English. So without further ado, I'd like to welcome Omari Maynard.
I'm not hearing anything. Is that only me?
No, it's me.
Yes, I think we had a technical difficulty, but we are going to welcome Omari Maynard, and Ronda is back with us. Thank you.
Good afternoon, everybody. Hope all is well. My name is Omari Maynard. I'm the co-founder of the ARIAH Foundation.
And my name is Andre Nelson. I am a healthcare analyst and health equity advocate.
Yes, so today I was just so happy to be here. So happy to be able to, have some time with you all to discuss what's happening in the field and what we're doing and our plans to, and co-creating and essentially creating this, Vital Village, as being a part of it. And Vital Village in itself, the naming and the words are just so powerful and so poignant because it does take a village, and it is vital for us to be able to create on our own accords, put things together and then push all of our common agendas in unison. So again, just so happy to be here, so happy to be able to let you guys know what we have on our horizon in terms of the ARIAH Foundation, and then also what Dre and I are co-creating collectively, which is called the Luxor Collective.
Yeah, I think, for me, looking as an analyst, looking at the data in terms of maternal mortality rates, infant mortality rates, I think in this country, it's atrocious what's happening. And so at the end of the day, I think we're all responsible, but I think us, especially as Black men, are responsible for trying to provide solutions to what's going on, and so looking at the data, I think that we've found that creating healing spaces for men, for partners, for non-birthing partners, to really be together, to talk, to have community, to really understand what's going on throughout the birthing process, but also have spaces to talk to each other and learn from each other and heal, I think is super important and can lead to a reduction in negative birthing outcomes. So I think before Omari kind of gets into the ARIAH and the Luxor, I think it's important to kind of set the context that what we're trying to do is data-based. We've done some research to see that, these spaces, healing spaces, are important. And also just kind of being there for each other, creating a community that ranges in ages and ranges in socioeconomic status and all kinds of things where we can just come together and really talk and heal.
Definitely, thank you for that, Dre. And again, just so that we all, have context, so that who we are and why we're here. I am the co-founder of the ARIAH Foundation, and the ARIAH Foundation stands for the Advancement of Reproductive Innovation through Artistry and Healing. And how the ARIAH Foundation was enacted was essentially through the passing of my life partner, Shamani Gibson. She passed away on October 6, 2019, 13 days after giving birth to our second child from a pulmonary embolism. Something that was extremely preventable, could be easily managed if she was listened to and provided the right service and care. Within those 13 days, I would love to be able to go through the entire story, but we don't have time for that. But within the 13 days, we did advocate. We made sure that we spoke to the doctors, we called the hospitals, let them know how she was feeling, told them that she had shortness of breath and troubles walking up and down the stairs and things of that nature. And still she was not listened to and not heard. And unfortunately she passed, but the silver lining from her passing is that, we were able to, again, create our foundation to be able to speak about maternal mortality, maternal morbidity, infant mortality, the importance of how we can rectify this maternal health epidemic and essentially tear down systematic racism through the healthcare system, and use art, entertainment, education as a way to be those conduits in order to have clear conversations and dialogue around how we can collectively, shift and change and see what we need to see as Black and Brown people living in this world.
So I guess let me, introduce how I kind of came into the picture really quick. As an analyst, I was studying healthcare disparities for a few years. When my wife got pregnant in 2019, I started researching maternal mortality rates and came to see that a lot of it was preventable. I think as of last year, or 2021, at least 80% of the maternal deaths were preventable. So after looking at all this data, I think I needed to humanize the data. And I came across Omari's Instagram page and really, just hollered at him and said, I see what's going on data-wise, but what's the story here? I needed to know what his story with Shamani was. And he was gracious enough to talk to me about it, even though he didn't know me. And we've been working together ever since.
Definitely. And through our story, we were able to participate in a film that was created around the story of Shamani Gibson and Amber Isaac Rose. That film is called Aftershock. You can watch Aftershock on Hulu. It's an amazing piece of art. It's an amazing piece of edutainment, and it speaks to how we can turn pain into power, how our grief and the traumas that we all face, just being Black in America is can be expounded, but at the same time can also show shift in knowledge, shift in education, shift in community, and how we galvanize each other in order to really show support and move forward. Thankfully, the film like I said, it's an amazing piece of art. It did extremely well. We won the Best Documentary by Sundance in 2022, and Monday we announced that we won the Peabody Award for 2023. So people are watching. Thank you. People are watching, people are listening, and we're just really extremely excited about the fact that they are, and that we can really use this time and energy and to try to really shift and negotiate the terms of what we need in terms of seeing what we need for our partners and our babies, so that they can make it safely earthside, and so that mother can be supported during her postpartum period, especially. So, with that said, one of the many things that ARIAH Foundation we're working on, we're going to really be focusing on two of them today. One of them is the Postpartum Awareness Week, and then the other is going to be the Luxor Collective. So the Postpartum Awareness Week, it is, I'm so excited about it. It's so amazing. And it took like 2 years to put this thing together, but it is here and we did it, and it is awesome. And I'm just so excited about it, and just happy to tell you all what it is and how you can participate and engage. So Postpartum Awareness Week, this is the first year that we're doing it. We wanted to create something. Thank you, Black Maternal Health Week, and for opening up pathways of ways to share information and let people understand exactly what's going on, with our women. So what we wanted to do though was, kind of double down on postpartum awareness weekend. Double down on Black Maternal Health Weekend and talk about the postpartum period, because the postpartum period is where we're losing most of our women to maternal mortality.
And birthing people.
And birthing people. Thank you so much.
Yes.
Thank you so much. Thank you so much. So postpartum awareness week is going to be from May 7th to May 13th. So this is May 11th. We're on day 5 right now. Day 5 is going to be, we're going to be talking about grieving together, emotional support for families, and how you navigate loss. And these are all virtual sessions. They're from 7 to 9 p.m. every night. On the 13th, we're going to be doing a virtual session, but we're also going to be getting together live as well at Brooklyn College in Brooklyn, New York. So, and that starts at 2 p.m. So hopefully if you're in Brooklyn, come out, show out, engage and support us. But if you are at home, absolutely no problem as well, because we're doing everything virtual too. And what we really want to do is break down exactly what postpartum is and all the nuances of it. So the grief piece, nutrition, activation, partnership support, these are all things that we're going to be, expounding upon this week. And in order to let people know exactly what postpartum is, exactly what information you can get, and exactly how you can use the community around you to, to educate, to gain support and gain grounding, but also too, to just be informed about what your rights are, what you have around you, and what your ability can be once you have and gain this knowledge to provide to your family, provide to your partner, to provide to your children, yourself, and then also your community.
Yeah, I think I just want to stress, we as partners, as husbands, we really know the process to be trimester. But if I can just impart anything, throughout this conversation, is that the postpartum part of the pregnancy is so important. And the more we know what's going on postpartum, not only with our partners, but with ourselves, I think that, things just get better from there. But I think the postpartum, 3 months after birth, up to a year after giving birth, it's really important to pay attention to what's going on and put as much focus on the postpartum period as the previous trimester. Shall we talk about Luxor?
Yeah, most definitely. I just want to let everybody know I just dropped the link in the chat for you all to register for Postpartum Awareness Week. If you're interested, please do. We would love to see y'all tonight. Dre was on yesterday speaking. I'll be on today speaking. So, and the awesome thing and the thing that we're really pushing is because, we want to make sure that we have way more men's voices in this space. When we think of postpartum or maternal health, we automatically think about, our birthing partner or our women, but it really is something that affects everybody, is inclusive of everybody, and is affected. Everybody is affected. And we want to make sure, again, that we're holding space and creating pathways for more men to be involved in these conversations, because it is so important, and it is about maternal health. But when we think about maternal health, honestly, there is no maternal without a partner. So it is effective of all people. So again, register, join us tonight and on Friday and on Saturday. But yes, Luxor, let's get into Luxor. Want to start off? Oh, go ahead.
Go ahead.
No, you good.
Okay, good. Luxor pretty much is just, the name comes from the Luxor temple in Egypt, ancient Egypt. I think most folks thought that it was built incorrectly, but it was actually built to mimic a man taking a step forward. And I think that's what we kind of kept in mind when we thought about the space is, how can we create a space for men, for people that identify as men, for Black men especially, to come and really be vulnerable. I mean, I think that, you know, it's a space where people can open up, be supported, be encouraged, and really, you know, stemming from men that have lost their partners. Really, I think that's the origin of Luxor, to support them. But also, we found that men that just have trauma in general, I think are perfect candidates to be in this space and be supported in that space. So I'm really, really proud and really happy to be a part of this thing that we've created, where we now see different guys from all across the country joining this virtual space every other Thursday and really opening up and sharing and healing.
Definitely. And just to, expound upon that, Luxor, like Dre said, it was created for men dealing with the traumas that are faced due to maternal health issues or maternal morbidity. But and it's also for a space specifically for BIPOC men. When I think about, the reason why this space is very near and dear to me and so needed. One, I didn't even know how much I needed it, but when we think about the history of Black people in America and just being specifically a Black man in America, there was a time where if you had a crowd of three people, 3 Black men, that was considered illegal, and we'd go to jail for being in groups. And the main reason is because when we think about, creating collectively, there's so much power that comes from having like-minded individuals together. There's so much power when we talk about grief, when we talk about our internal emotions, our deepest secrets. There's so much power in vulnerability. There's so much power in knowing that regardless of what's said, that you're covered. And, unfortunately, that power was taken away from us, and it was taken away from us systematically and very intentionally. And honestly, the Luxor for me, it really represents that shift in which we are taking our power back when I have lived a life, and I'm sure Drake is a testament of this as well. I lived a life where I very intentionally made sure that I walked the straight and narrow line. I made sure that I didn't get into trouble. I made sure that, when it was time for me to go to class, I was going to school. I made sure I got my education. I made sure everything was tip top because I knew what the system can do to Black men. And unfortunately, my experience is still got at navigating all these potholes that we still got caught up and I still lost my partner because of it. So the Luxor collective, it really is that shift, that power dynamic and a shift in where, we, can support each other and we can help each other become better individuals and therefore better people, men, for our families, for our community. And being able to impart as much wisdom as we can on each other and then in turn on the next generation. So, I'm just so happy that, we have a chance to do that now and that, in 2023, again, we can, even though we still suffer from systematic racism, social oppression, white supremacy culture, we do know that we do have the power to create those shifts and to do it collectively.
That was beautiful. Beautifully said, bro.
Thank you much. And you have anything else you want to end off with, Dre?
Just, I'm really grateful to Vital Village for having us on to talk about this, because both postpartum awareness and this Luxor collective, we're out here really trying to help heal people around us. And I think the more that we're able to speak about it publicly, the better off we are as a society as a whole. So I'm really grateful to Vital Village and to Boston Medical Center for creating this space. So thank you.
Thank you. Also, if you are interested in the Luxor Collective, in Postpartum Awareness Weekend, all the other things that the ARIAH Foundation has going on, please check out our website. It was put in the chat. Also follow us on Instagram, the ARIAH Foundation. And my personal Instagram is M_U_Z. Again, love to create, love to have all you all support and just be a part of our movement. And what is it? Rising tides raise all ships. So doing it together.
That's it. Well, don't go anywhere just yet. So thank you both, Andre and Omari. Don't go away just yet. I cannot wait to hear more from you during our Q&A in just a bit. So I want to invite folks, please continue to share questions in the Q&A, bring them in. We'd love to hear more. But in the meantime, it is now my pleasure to introduce Tiffany Vassell, registered nurse, founder of Nurses for Black Maternal Health and Equity, and board member of the Bay State Birth Coalition. Tiffany's going to share some remarks with us, and following her remarks, we'll hear some of the questions, and we'll jump into discussion. So I invite you to share more. Tiffany, welcome.
Thank you. Thank you so much, Rhonda. I'll go ahead and share my screen. All right, here we go. Thank you, everyone. Welcome. Thank you for having me. It is truly an honor to share this space with you. As mentioned, my name is Tiffany Vassell. I was born and raised in Boston. I've been a labor and delivery nurse now for 8 years, and I also used to be a substance use disorder nurse for about 4 years. I'm a mom to 2 beautiful children, Amelia, who is 10, and Cash, who is 9 months old. As mentioned, I'm also a board member of Bay State Birth Coalition, which is a consumer-led organization advocating for all families and birthing people in Massachusetts to have access to midwives and out-of-hospital birth options, including home births and birth center births. I'm also the founder of Nurses for Black Maternal Health and Equity, which is an organization that seeks to diversify the perinatal workforce, primarily through mentorship. I'm also the author of Preparation for a Hospital Birth, which is a simple guide that can be read in 90 minutes or less that tells people about the most common options and interventions they may be offered while delivering in the hospital, so that they're better able to advocate for themselves as well as for their babies. So who am I and why was I called to this work? I became a nurse at 32 years old. My BSN is actually a second degree for me. I've always been interested in nursing, but never pursued it until after the birth of my eldest daughter, which changed my life completely. My labor experience wasn't ideal, and I felt like I wasn't being listened to, and that the control over my body and my labor experience was slowly being taken away from me. This is the picture of Amelia and I shortly after her arrival in 2012. I had to be aggressive and assertive about what I wanted for myself and for my baby. At one point, they wanted to give me a C-section. I knew that that wasn't what I wanted. I was scared, I felt lost and unheard. I wasn't being listened to. It was my first baby. How could this be happening to me? Why was a C-section even an option right now? I knew that if given more time, I could have my baby vaginally. My very own sister wanted me to have a C-section, and I had to ask her to leave the room. I didn't feel supported by everyone in the room, and I felt lonely, and I knew what I wanted for myself. And I actually had one sister in the room who has always been a rebel and has always supported me and gave me the courage to stand up for myself. And you know what? 4 hours later, I had my baby vaginally. It was then I knew I had to be a nurse. I did an accelerated nursing program and obtained a job on a maternity unit right after graduating. Once I started working in the field, it was then I began to learn about the disparities. I knew I had to do something to save the lives of Black women and our babies. Fast forward to my little guy, Cash. This is Cash and I one day after his arrival last year. The experience with my second child was completely different. I remembered how it felt when I was having my first daughter, and just the things I've experienced as a labor and delivery nurse. I knew firsthand all the things that could go wrong. I was determined to do things my way this time. I decided I wanted a home birth. I researched and knew all the benefits of a home birth. I would be at home in my own space, no pressure or rush, and most importantly, I would be in control of my labor and delivery experience. Because there's currently no ease of transfer from home setting to the hospital in case of an emergency, I wanted to be certain that there were records available. So I received tandem care from a certified nurse midwife at a local clinic. After 36 grueling hours at home in labor and no baby, I decided it was time to go to the hospital. Upon arrival, I could feel the stares and disdain about my attempt at a home birth. But after mentioning I was a labor and delivery nurse, I believe I was afforded additional time that a non-medical professional would not have been given. 18 additional hours of labor, of controlling the titration of the Pitocin, of watching the monitors, of requesting a fetal scalp electrode. My cervix stopped dilating at 7 centimeters. I needed a C-section. I agreed and went back to the operating room. I didn't want to be rushed back emergently. That was my main thing, not to be rushed. I wanted to go back calmly and welcome my baby, and I did. A 10-pound and 22-inch baby, a really big boy. No one would have ever guessed that I was carrying such a huge baby, not my certified nurse midwife and not my certified professional midwife. I ended up leaving on post-op day 2 because I felt unsupported and wasn't receiving adequate pain medication. My home birth midwife and doula visited me by my 3rd day at home. I felt so supported by them and their love and their care around breastfeeding, helping me to become acclimated to being a mom of 2, and just really helping in the home setting. Why is Black maternal health? What is Black maternal health, and why is it so important? So according to the CDC, Black women are 3 times more likely to die from a pregnancy-related cause than white women. Multiple factors contribute to these disparities. In fact, out of all the developed nations in the world, the United States has the worst maternal health outcomes. The mortality rate continues to increase, with it currently being at 23.8 deaths per 100,000 live births. So what are some of the issues? Let's take a look. So right off the bat, some of the issues include implicit bias, structural and systemic racism and discrimination, social and economic factors, poor communication between pregnant people and their birthing team, poor education around birth, and not just the physiological process, but also the hospital process, the expectations and interventions, and of course, weathering. Here's some thoughtful solutions to these problems. Listen to patients, listen to us. We are the experts on our bodies. Our bodily autonomy and choices must be respected. We should always be held at the center of our care. Please remember, healthcare team, that you're here to support us during our experience, and communication is always key. It's so important to have doulas and peer navigators. It should be standard with care to ensure coordination and appropriate follow-up, as well as emotional and physical support during and after our pregnancies. We should have more birthing locations and options with providers, right? We need more location options such as home births and birth centers, as well as access to midwives. Studies have shown that access to midwifery care and freestanding birth centers improve birth outcomes. There are lower rates of preterm births, lower rates of low birth weights, lower rates of C-sections, as well as $2,000 saved per birth. We should seek resources from community orgs such as the Vital Village Network, Boston Healthy Start Initiatives, and Melanin Mass Moms, just to name a few. And last but most important, legislation. Legislation is one of the most important tools we can use to prevent disparities and to save our lives. We must continue to vote and place people in places that can create and enact bills and laws to address systemic inequalities by implementing policies that provide greater access to healthcare, reduce economic inequities, and promote culturally competent care. We have power when we vote. Why must we center our joy, healing, and equity? Centering joy, healing, equity, and bodily autonomy as a pregnant Black woman is essential for promoting positive outcomes, addressing historical traumas and racial disparities, and ensuring that we receive high quality and respectful health care. It is important that we focus on the disparities and address them, yes, but equally as important is our joy. Because we deserve joy, we deserve safe spaces, we deserve to be listened to, and we deserve to be treated and cared for well. And here's my book. You can find it on Amazon, and I'm also on LinkedIn, and you can find me on Instagram at Tiffany Vassell RN. Here's my email as well. Thank you.
Well, Tiffany, thank you so much. I'm going to invite join us back on screen. I'm going to share very briefly on screen just how you can drop a question in the chat box, because this is a great time to submit your questions. So you'll see this little icon on the bottom of your Zoom window. So please go ahead, drop questions. We have one or two in there. I have a few. But would love to take as many questions from you all as possible. And we certainly have some time to do that today. So I'm going to stop my screen share and let's get into this discussion. So I'm going to start with a question that came into our chat box from Hassan. They say, I appreciate how all of the panelists mentioned that supporting birthing people is something that we can do not just as family, but as a community. What are some of the non-traditional ways that folks can show up as friends, coworkers, teachers, etc.?
Dre, you want to talk about Seneca?
Yeah, so one of the things that Omari and I are working on is called Seneca Village. It's an app that we're creating. And the app really is for partners, for husbands, baby fathers, whatever the case is, whoever is involved in the pregnancy, to really keep track of what's going on. I think part of the problem, part of the issue here is Black women are very stoic, you know, and have had to be historically. And I think they shoulder, birthing people, pregnant women shoulder a lot during the process. And I think for us, creating this app is giving partners a way to be involved, right? To track if your partner, if your birthing person is having pain, track that to see how, you know, how long they're having pain, and speak up for them, advocate for them, you know, and don't wait for your partner, your birthing partner, to have to escalate for herself, you know. And I think that this app here is really for us to not only track what's going on in terms of pain and issues that might be going on, but also here are some of the things that you should know throughout the pregnancy. Ask questions, ask the OB questions when you're in there. Don't just be ignored. That's part of the problem that I had, is that, you know, I show up to these appointments and be completely ignored by the staff. And it wasn't until I started asking questions like, well, my wife has an issue with iron, what should we do? You know, and become engaged in that way. So, you know, I think the app really is focused on trying to make sure that we're involved by tracking what's going on, paying attention, seeing what's going on, and escalating when necessary. And also being involved in these appointments by asking questions and understanding where you are within your pregnancy and what you should expect and what looks not normal. And the more that we can be involved and advocate and understand what's happening, I think the more positive birthing outcomes we'll have.
So some non-traditional ways that people can show up for birthing people while in the hospital is, I will echo what Dre said, to be an advocate, right? Know what that birthing person wants. Be their voice. A lot of times when people are in labor, you know, you're in pain, you may be uncomfortable, you may be exhausted. It's so valuable to have someone with you that can advocate on your behalf and let your healthcare team know what your needs are and what you expect and what your hopes and wishes are around your delivery experiences. Other non-traditional ways that people can show up for you once you're back out into the community, right? Because that's when the real work, real life begins, right? Because you're only in the hospital for a very short time. When you're back in the community, you need so much support from your village, right? It helps so much to just, as a coworker or, you know, a friend pop in, hi, can I do your laundry? Can I drop a meal off at your doorstep? Being a listening ear, right? Who knows what trauma that person may have suffered during their delivery, right? Just to listen. Perinatal mood disorders, right? The people suffer from postpartum depression. People suffer from anxiety. Just being there to hear and listen to what the person is going through and sharing a kind word can go a very long way. So I think these are some really great ways that you can show up for friends or a birthing person.
Thank you both. So we have a new question from Shayna. They say, in a recent training my organization did with healthcare professionals, I advise these professionals to ask their pregnant patients, especially people of color, do you feel heard? Then listen to their answers, even if they are uncomfortable to hear. Do you agree with this advice? Are you aware that this is becoming a part of best practices and medical professionals training and education?
I can answer that. I think that's a great question, Shayna. It should become part of best practice. I know when I have my patients, I do ask them, do they feel like their needs are being met? Do they feel like what they envision the process is? Do they feel like it's going that way? I do make it a point to ask because I think it's important that people receive the care that they want and that they deserve. It is not practice, but I think it's awesome that you are including that in your practice because it is important to know if people feel heard or if they feel like their needs are being met while they're doing this process.
Thanks, Tiffany. I have another question. I may mispronounce the name, but I'm going to do my best. Shokdil, I think. They say, thank you all for sharing your gifts and wisdom. What can advocates and practitioners for birth equity do to hold systems, so hospitals, doctors, nurses, legislation, training, accountable for recognizing bias throughout the perinatal, postpartum period that so often leads to trauma, pain, disability, or death?
I mean, as an analyst, I think from my perspective is data always speaks the truth. It doesn't matter what your opinion is. The reality is that when you look at the data, that it's, there's no easy way to say that implicit bias and racism is what's happening negatively to our birthing folks, you know, and leading to negative birthing outcomes. So I feel like to hold these organizations accountable is just to say, look, I need you to listen to me, listen to my partner. I have data to back up why I am nervous or feeling some type of way about what's happening. And just use that as your sword of truth, you know? That's my perspective.
Yeah, I mean, I was going to pretty much say the same thing. The way we get the data is if you share your story. Like we all have a story. Unfortunately, if we don't have a story, we know somebody 1 degree from us who has this traumatic story is centered around, or because of what happened to them in the healthcare practice or system. So, you know, share your story. You know, this is and talk to people. Be a part of, you know, these studies. In order for us, for Black people, to get the things that we need, we have to make sure that we are, again, telling our truth so that somebody else doesn't tell our truths for us. Because, once that happens, then it's not ours anymore and it becomes something that doesn't serve us. So please, share your story.
Mhm.
Yeah, to echo what Omari and Dre have said, data collection is so important. We need these boards to review the mortality and morbidity data and share the data with the public as well. We definitely need to have continued and increased training around bias, implicit bias. Standardizing care is super important, right? When you do care and offer care a certain way across the board, like, look, if a patient has, we suspect preeclampsia, we know the patient comes in, we're going to check blood pressure, we're going to do it at this interval, we're going to do it this way. These are the meds that we're going to give, right? There's an algorithm. Research has shown that when care is standardized, that disparities are fewer. And then really, when you see something, say something, right? You see someone giving a care that seems biased. You hear someone say something to them, call them to the side, have a discussion with them about it and why it's not appropriate. And if it doesn't go over well, you can always, of course, talk to management about it, but don't just not say something. Definitely say something, right?
This is great. So we have another question from Felicia. Felicia says, I'm so moved by everyone's story. I have a question for Tiffany. I live in Memphis and I'm currently writing a policy recommendation on doula programs to address maternal health crises. Would you have any pointers or recommendations to put into this policy memo? I took note of your solutions and also thank you everyone for your time.
So first I have to say, I love doulas. I love doulas. When I walk into a patient's room and I see a doula, I say yes, because you know what? We're part of the same team. And our ultimate goal is to have a safe delivery, a safe and joyous delivery, right? Some recommendations, I guess I would say to include in the policy is that definitely to have doula care. Where the recommendation now is at least a year of postpartum care. That's what everyone is really advocating for. I know Massachusetts, we've codified that for people receiving mass health. It would be great if people could get doula care for up to a year and have it being reimbursed by insurance, right? Because even though you would get care from your provider, you're still not seeing or speaking to them as frequently as you would your doula. I think that would be awesome. Having it be standard of care to have a doula, I think that would be great. A lot of times I find that if a provider doesn't recommend it, the patient doesn't get it. So it should just automatically be something that patients get. I think that would be great to include. And yeah, Felicia, we can hopefully, maybe we can exchange information and follow up and come up with a few other ideas you can include in your policy memo.
Yeah, just to piggyback on that really quick, I know that New York a few years ago launched some doula programs in which I believe Medicaid was covering some of the costs for that, because maternal mortality rates in Brooklyn and the Bronx are just ridiculous. So Felicia, you may want to just look at that research and include in your policy like some type of Medicaid coverage. Maybe you could figure out like how to do a practice, round or something like that. Just do some research on New York and their Medicaid coverage for doulas, because it should be covered absolutely for patients that need it. So.
And also to really quick, I know the Save a Rose, so Bruce McIntyre's organization, Save a Rose Foundation, they offer subsidized payments for doulas as well. So anything that's not covered by the insurance company, they have a scholarship that allows for the rest of it to be covered for families as well. So, and in my brain, I'm sure they're not the only organization that does it. I'm not sure where you're at, but you can look into other organizations who do provide those type of services as well.
Absolutely. Yeah, and I'm so appreciative of the questions, and I invite folks to continue to share more. And I want to ask you all, because you all mentioned about various collectives and collaboratives and coalitions that you're a part of. And I think it's really important to hold folks, to hold providers accountable. But I'm also interested in hearing about what you've learned about collaborative leadership around birth equity. And so specifically about in your coalitions, in these collectives, how are you making decisions together? How are you coming to those decisions about the work that you're going to do and the work that you want to move forward? So I'm pivoting us a little bit, but would just love to hear a little bit more about that.
I know for the ARIAH Foundation, the great thing is that we offer a unique perspective on how we provide information and how we use entertainment to educate. There are other organizations like Save a Rose who specifically, focus on doula care, midwifery services, and then other services that they provide to the community. I think to that answer your question, like this process is a very heavy lift for everybody involved. So just again, wearing a t-shirt, shouting people out, letting people know that, yo, you're doing a great job, is a lot, and it goes a long way because when you're in the everyday, and doing it every day, it is easy to lose focus and lose sight on the mission because of, things may not be moving the way you want, especially when it comes to policy reform and things of that nature. When you have other entities that are systematically blocking certain things from happening, so that's one. And then also too, like Tiffany said, is the boards, getting on the maternal mortality board, getting on those type of committees where, there are people, in your local area who are, putting in the work and are creating space for us to sit collectively and come up with certain policies, come up with verbiage, making sure that we are in the know of what is new because everything changes so fast, so often. It's important. So, and then of course, other than that is, using social media, and other engines such as that to, again, see what's happening, see what people are doing in their local area, and just being able, quick, fast way to share information with, the community in large.
Yeah. And Andre, I have a question because you brought up something in your remarks a little earlier around healing and that your work is sort of centered and focused on healing. And I'm going to start with you, Andre, but I would love to hear from all of you. But what has the healing process looked like in your work?
Yeah, I think what's really interesting about the Luxor collective is that I think a lot of men come into the space not really knowing what to expect. And I think once we model the behavior of being vulnerable and asking the question like, how are you doing? How are you doing, Omari? He's not just gonna be like, good. He's gonna say, man, I had a tough day. I was trying to do X, Y, Z. Like he'll go into it and we'll hear him and be able to relate to him immediately because it's a human story and we're all going through the trials and tribulations of life. So for me in our work, when we have just regular conversations, we'll have a topic for the evening and just have men share around the room. By the end of the night, almost always there's at least one new brother that's on the call that's like, I really needed this space. And the first time I heard it, I was just like, all right, well, that's cool. Like we have this space for people to talk. But after hearing it over and over again, I'm like, there are a lot of people that are hurting inside. There are a lot of men that just don't have avenues to talk about how they feel because of what society has, built up for them to portray who they should be and what they should be chasing after and how they should feel, as opposed to really looking inward and sharing what's really on their minds and their hearts. So what healing looks like is a man calling for the first time on a Thursday night, sharing what's going on in his life. And then at the end of the night saying, I thank you both for really creating the space because I really needed that conversation. I didn't realize how much I needed that conversation. And that's it. You know, we've only created a space for people to talk. We're not doing anything medically or, you know, and that touches me. And we show up every weekend, just every other week, just for that. So for me, that's what healing looks like. It looks like being able to share what's on your mind and your heart, be yourself authentically, and have people encourage and support however it is that you're feeling at that moment in time.
And real quick, so with the reason why our collective is so dope is that, you know, we do have specialists and professionals in the space as well. So my therapist comes on every week. We have a grief counselor that comes on every week. We have men who have their own youth organizations as well as men's foundations who come on and share, you know, so it is that very good. It's like the cross between men just coming together and talking shit, really, and men actually getting, you know, professional help so that the conversations don't necessarily go way left, or if there's real need other than what we can do in that 1.5 hours, they have a avenue to go and get even more support, you know. So it is that really good, you know, blend of what's really needed.
So what healing looks like to me is listening, communication, less of me as a nurse and more of my patient, helping to create the space that they want. Oftentimes I think about my own birthing experience and how I felt and how I don't want my patients to feel that same way. So I try to create the safe space that I wanted for myself for them. So that's what healing looks like for me.
Beautiful. I know we're coming to the end of our time. We just got one more question in the chat. So I want to, or in the Q&A. So I want to offer that question. Comes from Pamela. They say, are there advocates who support family members who find themselves caring for a newborn who have lost their mothers during childbirth?
Can you repeat the question one more time? Sorry.
Yeah. Are there advocates who will support family members who find themselves caring for a newborn who have lost their mothers during childbirth?
Yeah, the ARIAH Foundation. Yeah, we you know, the reason why I was enacted is because, you know, we lost Shamani Gibson. Save a Rose Foundation. The reason why I was active because we lost Amber Isaac Rose. And again, there are a lot of other organizations as well, you know, but
Charles Johnson, does he have a foundation as well?
For Care for Moms. Enacted because, you know, Charles Johnson lost Kara Johnson, his wife. So there are organizations out there. There are, you know, collectives that are out there. And again, you know, if there is somebody that you know who needs somebody to talk to and lean on, you know, we're here. I think in our last men's group, we had 4 men on who lost their partner, you know, due to maternal mortality. You know, so there are
One gentleman who had lost his partner 2 weeks ago.
weeks ago.
And I love the fact that these foundations exist, but I hate the fact that these foundations exist.
Exactly.
They shouldn't have to, you know, and it's unfortunate, but yeah, they exist.
Oh yeah, and other programs too. I see somebody put in the chat. But Healthy Start also offers a fatherhood program. They have 101 organizations around the country. You know, so you can probably find a local Healthy Start that provides some type of fatherhood program. And essentially, the reason why I'm saying fatherhood is because I'm sure there is a man in there who has had to deal with some type of either maternal mortality or maternal morbidity issue.
I know we have come to the end of our time. This time has flown by. So in my mind now, I'm like, okay, now we need to invite all of you to our podcast as a recording for season 2 to continue this conversation. Because I had so many questions I didn't even get to ask. So just wanted, for Tiffany, Andre, and Omari, I just really want to thank you for joining us today, because you all have shared how you're shifting the narrative and shifting what it means for Black and Brown families to bring our babies into the world in joy and health and in safety, as well as creating spaces for collaboration and community while you're doing this work. And your work is critical to the health and joy of our communities. And so we're grateful to have your partnership in the village. For our participants, don't go just yet. I have a couple of things to share before you head out. Just some ways to stay connected and keep up with us. Our webinar series, this series will continue in November of this year, but in the meantime, we have lots of ways for you to stay connected. Our podcast series, In the Arena with Now, will be returning for season 2 this summer, and you can find it wherever you get your podcasts. So tap in. If you haven't checked out season 1, you can go back and check it out. Another thing I'm super duper excited about, we will be holding our 10th annual National Community Leadership Summit this October. This event will be hybrid, so you can engage in person in Boston and virtually. So we hope you will join us. As well as just a couple of other resources to learn more about our approach to shared governance, collaborative leadership. Check out the Now Playbook at the Now Innovation Forum. It's a how-to guide for transformative community capacity to advance equity. We also have our dignity-centered guide to reflecting on cooperative funding structures as another guide for exploring funding partnerships. Lastly, just thank you for taking time out of your day to join us. We look forward to connecting with you on the forum through social media. Please share your stories with us. We want to uplift them. We would love to have folks on our podcast and our blog. So yeah, thank you. Have a wonderful day. Take care of yourselves, take care of your families, your communities, and each other. And we'll see you next time. Bye, everybody.
Thank you, Ronda. Thank you.
Bye.
Thank you. Peace.